Hello everyone, in this video we are going to discuss about necrosis and its types. So whenever there is persistent ischemia, there is be persistent hypoxia. Hypoxia will inhibit the aerobic cellular respiration and activate the anaerobic cellular respiration. So since there is no aerobic cellular respiration, there will be ATP depletion. So this ATP is actually mainly useful in two pumps, calcium ATPase pump and sodium potassium ATPase pump. The sodium potassium ATPase pump will pump out 3 sodium ions in exchange to 2 potassium ions inside, and calcium ATPase pump will pump out calcium ions. So whenever these are inhibited, there will be increase in the sodium ions because these are not being pumped out, there will decrease in the potassium ions because these are not being pumped in, and increase in the calcium ions as these are not pumped out. This increase in the calcium ions will cause mitochondrial dysfunction, leading to decrease in the ATP. Then this also acts as a cofactor for various enzymes and activates various enzymes like ATPase, protease, endonuclease and phospholipase. ATPase will decrease the ATP, protease and phospholipase will cause plasma membrane damage, and endonuclease, as the name suggests, it will cause chromatin damage. So coming to the types of necrosis, first one is coagulative necrosis. It is the most common type, and the tissue here will be pale, dry and firm. There will be preservation of tissue architecture. This is the most important point. There will be loss of cellular enzymes leading to protein denaturation and cell death. So it is clinically seen in tissues, very solid organs like heart, kidney and spleen. This is the picture showing the coagulative necrosis, and here the most important point is the tissue architecture is preserved. Next is liquefactive necrosis. In liquefactive necrosis, as the name suggests, the tissue will turn into liquid due to hydrolytic enzymes, and tissue becomes very soft and viscous. So enzymatic digestion occurs, seen in brain infarctions, abscess and pus formation. Liquefactive necrosis generally occurs in brain and spinal cord because this brain and spinal cord are covered by myelin, not the collagen. If they are covered by collagen, they would have been not damaged. But myelin is not that firm and not that resistant to this necrosis, so liquefactive necrosis occur. Next is caseous necrosis. As the name suggests, caseous means cheese-like appearance. It occurs in granulomatous inflammation with central necrosis. Cell death due to chronic inflammation and granuloma formation occurs in tuberculosis. So this is the picture showing the liquefactive necrosis of brain, and this is the picture showing caseous necrosis of the lung. Next is fat necrosis. It is generally associated with liquefactive necrosis. Here, chalky white appearance due to saponification is seen. Here, breakdown of triglycerides by lipases produces fatty acids that binds to the calcium. So that's why we will see chalky white appearance. It occurs in pancreatitis and also in trauma, in breast injury. Next is fibrinoid necrosis. It occurs due to immune complex deposition and fibrin leakage in the vessel walls, generally seen in the vessel walls. This is showing fibrinoid necrosis. And this is the fat necrosis. So occurs in polyarthritis, lupus, polyarthritis nodosa, lupus and other autoimmune diseases. So gangrene and necrosis, it is of two types, gangrene, dry gangrene and wet gangrene. Dry gangrene is generally a coagulative necrosis, typically occurs in lower limbs due to coagulative necrosis. Wet gangrene is liquefactive necrosis. It is foul smelling tissue with it is generally associated with superimposed infection. So dry gangrene is a coagulative necrosis and wet gangrene is liquefactive necrosis with infection. So it is seen in diabetic foot in dry gangrene and bowel infarction in wet gangrene. There is a clear demarcation in dry gangrene, but no clear demarcation will be seen in wet gangrene. Because of complete loss of blood supply, dry gangrene does not cause any infection generally, but wet gangrene, superimposed infection are more common. So this is the gist of all the types of necrosis.